Welcome guys to my YouTube channel. My name is Nasan and I'm back to talk about infertility. Causes of infertility in women includes ovulation disorders. This is the release of the egg from the ovary. There are some of the factors that are going to affect the release of this egg from the ovary, and these conditions will include chronic conditions like cancer and HIV, and also what we call thyroid disorder. Like if you have thyroid issues, goiter and so on, it's always good to be checked and control the TSH and all those hormone T3 T4 before you consider getting a child or getting pregnant, because this hormone will hinder the ovulation process or the release of the ovum from the ovary, therefore making your fertility an issue. There are also other conditions like hyperprolactinemia, whereby you have high prolactin hormone in your body. This is hormone disorder. Make sure they are well controlled, and also ensure that your egg quality is checked. You might be producing egg, yes, but it is of not good quality, or what we call premature ovarian failure. You are just releasing premature ovum, whereby they cannot be fertilized. Other conditions are like endometriosis. Endometriosis will hinder even in implantation of the fertilized egg. So it is always good for you to check and make sure that these conditions that affect ovulation disorders are corrected on time. Another factor that affects infertility or causes infertility in women includes uterus or fallopian tube abnormality. This is whereby either the fallopian tube or the uterus are not conducive to allow fertilization and implantation to take place. And there are some factors that will cause this to happen. If you have a surgery, either, for example, on a fallopian tube, during healing, there is what we call scarring. Scarring might occur, and therefore narrowing the fallopian tube. This will hinder the movement of the ovum that has been released by the ovary to come along and meet with the sperm, and therefore affecting fertilization. Another thing is whereby the egg has been fertilized, the fallopian tube is okay, and now it is moving to the uterus, but now there is a problem now in the uterus, whereby the fertilized egg cannot be implanted. Implantation cannot take place, and some of these things that will cause implantation issues includes like when you have endometriosis. Endometriosis is whereby the endometrium tissues grow outside the uterus. Therefore, instead of being inside the uterus and enable implantation, it has grown outside. And also, or you have submucosal fibroids, whereby these are benign tumors. They are tumors, but they are not cancerous, that grow inside the uterus, therefore occupying the larger space of the uterus, and therefore might affect implantation. Or sometimes implantation can take place, but at a point that pregnancy may miscarry. You may miscarry because of the competition. Sometimes fibroids and babies compete. It is always good when you notice that you have some fibroids, depending with the size, and the doctor has explain to you the size and some of the effects that it might cause. I'll always advise that it's good to go and remove the fibroids, heal, and then consider conceiving. But sometimes they are very small. If they are small, you can consider having children earlier or faster before they grow big, because they usually grow and they might compete with the babies. And it is always some of the reason as to why it might affect tube, or it might affect implantation and so on. Another thing is if you have this condition like STD, especially chlamydia usually affect the fallopian tube, whereby it narrows and scars, and it causes so many effects on the fallopian tube. And the explanation will still be it affects the fertilization and the motility of the ovum from the fallopian tube to the uterus. It is always good to treat your sexually transmitted diseases on time, and ensure that you have healed very well before you consider having a kid. Other factors that might increase the chances of infertility are age. Women are considered to have low chances of conceiving as age goes. Like if you are getting 40, 45 and above, your chances of being pregnant starts going down. So the higher the age goes, the lower the fertility rate goes down. And actually, this is actually you are going towards menopause. For men, they don't really get affected with age so much, though they are, but not so much. But for women, for us, we have what we call menopause, whereby you stop menstruating, and if you stop menstruating, that means that you are not able to conceive and have children. Therefore, always watch for the age as you pursue your careers. Watch how your age is going. Also, alcohol, excessive alcohol use, and smoking, it has an effect both to men and women. Ensure that you reduce on your smoking, and you reduce on your alcohol use. It has an impact on a woman fertility issues. Obesity and underweight. If you are obese, it is a problem. If you are underweight, it's also another problem. Always work on your weight. Make sure you are within normal limit. You are not too underweight and you are not too obese. Actually, obese has more effect than underweight. So ensure that you control your weight, do exercise, watch your diet. If you are thinking of having or conceiving or getting married, they usually advise like check on your weight, make sure it is within your BMI. Ensure that it is within your BMI. Don't be too big. And also, if you are too small, ensure you sit down and eat well, so that you can have your child without struggling. Because you might not have any medical condition, but just because of weight, it might affect your fertility. Also, there are some of chemicals that will end up affecting your fertility. Like if you're working in a condition that you are exposed to lead or pesticide, it is always good for women to be considered not to work in such an institution, or if they had to work because of some reason, let them have protective gears so that they are not affected by these chemicals, or rather pesticides. It is always good to watch out each and every condition. There are other factors, but these are some of the major factors that might affect your fertility as a woman. Always remember that it is good for you and your husband, two of you, to go for investigation. It's not good to go only alone, so that all of you are done investigation and they really find out where the infertility issue has come from. There is no need of blaming your partner for any reason. They don't choose to be infertile. That's why they have decided to settle down and have a family. If only they have chosen on infertility, then there could be no reason for them to start a family. Let us support each other to reduce the mental issue problem, because this is the stigma issue in the society, whereby if you don't have a child, it is a society issue, not as an individual. It is a society issue. Like so and so don't have kids, so and so don't have kids. Kindly let us support each other. Let us give advice. Let us go for counseling. Let us get the correct information from the correct people, because not all information is good for your health. It might end up destroying you more. Before you go for any advice or any medication, please you ensure you are getting it from the right source.